Thank you very much. So my name is Navjot Virk. I'm the Research and Innovative Practice Coordinator with the Brenda Strafford Foundation.
And my name is Izzy.
And we are honored to present on behalf of Wentworth Manor and the Brenda Strafford Foundation the end-of-life framework and program that was developed by our care teams. So to begin with, a little bit about us. The Brenda Strafford Foundation has been providing excellence in seniors care for over 40 years. We currently have 4 care homes in Alberta, 3 of which are in Calgary, which are Beauview Manor, Wentworth Manor, and Clifton Manor, and we have 1 in Okotoks, which is Tudor Manor. So when we're looking at our environment, it is a continuing care environment, primarily long-term care and supportive living, and our population and those that we serve are older adults or residents and their families and loved ones. So the challenge, or what we like to term it, is the opportunity for improvement was really identified through satisfaction surveys and focus groups with residents and families. In the last 15 years, as shown in the literature as well as our anecdotal experience, there has been a significant change in responsibility in long-term care and supportive living homes. Most of our residents do live with us right till the end of their life, and the experience can be challenging or complicated, especially for those living with dementia due to the loss of their cognitive abilities. A lot of times decision-making related to care needs often rests with family members, and so we found that there was a unique opportunity to really look at enhancing the capacity and skill set among our employees to address this shift in change, as well as look at our palliative care programs and processes in a holistic lens. And so the way that we did this was really through the feedback that we received through satisfaction surveys and focus groups. But we also did a needs assessment, and this was done in collaboration with the University of Calgary Faculty of Nursing, community practicum students at Wentworth Manor, where they went and asked our residents and families in terms of what they thought would be the most important areas to focus on when enhancing our palliative care program. And so when looking at this program, we really wanted to hear from them. And so a key area that was identified for improvement was by residents and families was looking at relationships and emotional support at the end of life. And in addition to this, employees also had identified that there was a knowledge gap or an opportunity to enhance their knowledge around palliative care processes. So the solution, the very exciting thing about this was that we had the entire interdisciplinary care team come together to hear from what the residents and families were saying and come up with a solution. And so this involved our frontline staff from healthcare aides, LPNs, RNs. We had physicians, recreation therapy staff, pharmacists, as well as leadership support from our medical director, director of nursing, and administrator, who really looked at how we can incorporate what we heard into a framework to enhance the delivery of palliative care to residents and families using a holistic approach. And so I'll outline a couple of the interventions and things that we had implemented, focusing on the domains of physical environment, relationship, and planning and delivery of services. So when we started out the initiative, we really looked at creating a palliative care bullseye framework, and this was by looking at the evidence and what the literature had identified in terms of important domains for palliative care. When we looked at the physical environment, what we heard from our family members was there was an opportunity to promote comfort in the physical environment, and what we introduced were palliative care carts, which are pictured on the slide. The purpose of these palliative care carts are to provide comfort, and they have different items such as refreshments, toiletries, robes, magazines, etc., to be brought right to the bedside of their loved one during this process. When we look at relationships, what we heard from family members was that they would like to have more of an opportunity to learn more about what does end of life look like and the different experiences that their loved one may be going through. And so these family nights were introduced in partnership with residents and families to really enhance the knowledge and support, but also have an opportunity to answer questions that they may have for us. Another tool that was implemented was a brochure, and this brochure was really to highlight tips and techniques of having high quality end-of-life conversations. And so Those were the primary elements that were implemented with respect to relationships. And then the last piece was planning and delivery of care services. So we spent a lot of time looking at addressing the knowledge gap among our staff, and this was addressed by having our staff trained through the Pallium LEAP course. We also had our clinical nurse educators provide extensive education and mentorship for our staff. And another large piece of this was looking at ways that we can identify a change in status among residents earlier so that families feel more prepared during the end of life. And this was accomplished by looking at RI data in different scales. I'm going to hand it over to Izzy, who's going to provide a frontline perspective from the healthcare aid point of view.
While planning the palliative care program, the coordinator asked me this question. As a healthcare aide, what can you contribute to improve the quality of life and provide comfort to our residents? I responded by saying, since I have a passion in singing and I love to cheer people up by words of encouragement or a simple smile, I can organize a singing group made up of fellow workers to help bring comfort and peace of mind to the residents and to the family. Healthcare aides are the first line of care. We spend a lot of time caring for them. That they learn to trust us. I have learned in my conversations with them that many are Christians. One of my favorite things to do is to sing their favorite hymns and even request songs to sing, and we believe that music is the language of our soul. Every time we have palliative residents, the singing group will visit and offer songs including their favorite hymns. We believe that is an extra layer of support to the family. When they pass away, our team will go again and give tribute, words of encouragement, and songs for the family. We offer prayers too. We have received lots of compliments, and one family member shared his thoughts about our songs. He said that once we started singing, the room was filled with hope and comfort in spite of the pain that they were experiencing. That's how it all began.
Perfect. Thank you, Izzy. That example really illustrates our palliative care Bullseye Framework, and I won't go into it into too much detail, but the key of this is that the resident and family is at the center and the core of the framework, and around them is layers of the onion or the bullseye that we had created. And so just as an example, the first layer was looking at different common issues, again, identified by residents and families, and examples include symptom and disease management, loss and grief, and really making sure that we meet the holistic needs as illustrated through Izzy's example. So in terms of evaluation, we did conduct evaluation pre and post, primarily through doing surveys and chart reviews. What we really found was that for family members, they reported an increased comfort and support through improved communication, continuity of care, and emotional support provided at the end of life. And with the healthcare team, they also reported an increased comfort and knowledge to provide palliative care. And so it was really about enhancing capacity, but hearing what family members and residents had to say. We also have two quotes illustrating the impact. The first one here is from our medical director, Dr. Mary Jane Schenkel. And I just wanted to focus on at the latter part of the quote, which really was feedback from one of our family members. And what they said was that they felt that this was the single most powerful experience in their life that they had ever experienced. We also have another quote from one of our frontline staff members who said that the program really allowed them to provide the best care possible and address the needs of our residents. So in terms of spread and sustainability, we have scaled this initiative to the other care homes within the foundation that I mentioned at the start of the presentation. The program was also shared through different forums such as external presentations and conferences by the Director of Nursing, and we have sustained it through ongoing education and mentorship by our executive and clinical leaders. So to summarize, we felt that this quote really encapsulated the reason why we embarked on this journey to improve care, and it's from Dame Cicely Saunders. It says, "You matter because you are you, and you matter to the end of your life. We will do all we can, not only to help you die peacefully, but also to live until you die." Thank you.